Well, hey guys, happy Vlogtober Day 5, buzzing along. Halloween will be here before we know it. As you can tell from the title and thumbnail, today's Q&A is going to be another highly requested topic, and that is cherry angiomas. Those pesky little red spots that appear on the chest, back, buttocks. Many of you out there are keenly familiar with these. If you're not, they are a benign, very common skin growth that actually is a little growth of blood vessels in kind of the upper layer of the dermis. They can appear as just a tiny little pinprick to a few millimeters in diameter. They are bright cherry red, as the name implies, and they are very common. They tend to occur on the trunk, so on your chest, your back, buttocks. They can also occur on the thighs, the arms. They can occur on the face, but less common there. They, as I said, they're completely benign, and they are very common. They tend to appear in the third decade of life in adults. They're more noticeable in Caucasians or very fair complected skin, but anyone can get them. Men and women get them equally. They tend to appear in our 30s, and we may get a few of them then, and as we get older, more of them appear. Also, you can several of them can appear during pregnancy and then regress for whatever reason during the postpartum period. So it's not uncommon for pregnant women to develop several of these, sometimes on the face as well. It's thought to be related to some of the changes in hormones that go on and growth factors that are up during pregnancy to support the growing blood supply to the developing baby. So that maybe that's why they occur. We're not entirely sure, but suffice it to say, they are completely harmless little red bumps. It is not unusual for adults, particularly adults in their 60s, to have a couple hundred of these. And I think that's one of the things that alarms people the most, and oftentimes will bring them to their doctor, to a dermatologist, to figure out what's going on. People are terrified, like, why do I keep getting more of these? I'm covered in them. I never had this in my entire life. I do know, however, that situation is not uncommon. It doesn't mean anything about your health. It's completely normal and not unusual whatsoever. These red spots tend to not go away on their own. So what can be done about them? Well, first of all, there's nothing that you can do to get rid of them, all right? There is no over-the-counter cream that will get rid of these. They occur, kind of deep down in the skin, in the dermis, in the upper layers of the dermis. So there's not like a cream or any kind of peel or topical thing that you can attempt to do to them to get rid of them, all right? It simply just won't work. So avoid, some sort of crazy DIY remedy with lemon juice and, battery acid and a bullet. No, there's no DIY remedy that will get rid of these. And attempts to do so will result in potentially scarring. So just back away from whatever Google is misleading you to do. They can be removed by a dermatologist, or most family practitioners probably are comfortable taking care of these as well, since they're so common. They can be removed by a variety of different means. One way they can be removed fairly easily, particularly if they're large, is to just scoop them out with a surgical blade. It's called a scoop saucerization or a scoop excision, to remove the little red bump. And then the area that was cut out can just be sealed up with a little bit of chemical cautery, and the skin will heal. Now, that can often leave a little tiny scar behind, like a white spot, so you may not like that. You may have preferred the red bump in the first place, or you may be okay with that little white spot, and it may be something that you're fine with, depending on where in the body it is. If it's on the trunk somewhere and you just want it to be gone, you don't care if there's a little white scar there, then that's an option. The other very, very popular way to get rid of these a technique we use to get rid of a lot of common benign sort of nuisancey skin lesions like this is electro desiccation, that little zappy tool that many physicians have. I talked about it in my warts video. Talked about it in the video about dermatosis papulosis nigra. A little bit of electrocautery can actually seal off that abnormal collection of blood vessels, coagulate it down, and they kind of die off and involute, and the body just engulfs it and gets rid of it. That's very, very effective and very easy to do, not painful. A little bit of numbing medicine is put under the skin. And after the spot that's treated regresses, tends to not come back. So it's pretty effective. And then another option, particularly when you have tons of them that you want to kind of get rid of, is to use a laser. That's going to be a bit more costly because there's a cost associated with owning and operating a laser that the healthcare provider has to cover. And so that can be a little bit more costly depending on what the dermatologist or plastic surgeon or healthcare provider who's doing this kind of has going on as far as their practice. But lasers, specifically the pulse dye laser that target redness and blood vessels, I've talked about them in a lot of videos, like my laser video. Those can likewise seal off that abnormal collection of blood vessels, coagulate it down, and it will involute and go away. And like I said, recurrence after they are effectively treated is unusual. The thing that you should be aware of, however, is that treating one or a few of them is not going to prevent you from getting more of them down the road. So, kind of wrap your head around that. Having these, getting more of them is kind of just part of something our body does with time. Why that occurs, we don't know, but it's not dangerous. So treating them, will usually get rid of the spot that's treated. However, it does not prevent you from getting more of them along the way, and there's nothing that you can do to prevent getting more of them down the road. They don't appear to be related to sun exposure. I mean, they occur in sun-protected areas on the body, so I can't even beat sunscreen and sun protection into you as a preventative measure for these, because they're unlikely related. They don't appear to be related to sun exposure. It's just something, I don't know, our body sometimes gets bored and does like bizarre things. It's like, I don't know, we need TV or an iPad to give our blood vessels in the skin sometimes something to do. They just get too I don't know, cavalier and start doing bizarre things that are useless to us and a nuisance. These spots, while they are cosmetically bothersome and, can be quite numerous, they don't, again, underlie anything serious. They're completely benign. They can, however, if rubbed or irritated, occasionally they can bleed. If they are, agitated or rubbed, or, you whack up against something, they can bleed, and that bleeding can be kind of ongoing because it is this little collection of blood vessels, so that may alarm you. And again, the little electro cautery device that we use in the office is something that can intervene on those. A little bit of direct pressure can control that kind of weeping bleeding that's going to occur, and they'll kind of crust over and scab up. But otherwise, they usually don't bother people. They should not be painful. They should not throb, have any pulse to them. If you have a red spot on your body that does these things, that is a red spot that is painful, a red spot that has like if you touch it, it's got a pulsation to it. These are signs of some slightly different red spots that you should bring to the attention of your treating healthcare provider to make sure you know what you're dealing with, because there are a variety of things in the skin that kind of look similar. So to be safe, particularly if the spot is symptomatic, be sure and bring it to the attention of your healthcare provider. Anything that bleeds easily and anything that bleeds on an ongoing basis, particularly if it's new, always bring to the attention of your healthcare provider, because skin cancers can present that way. So just to be safe, just to make sure that that is what you're dealing with, that is something to do, just to make sure that everything is safe. Like the other benign skin lesions that I've talked about on here before that are largely, quote, a cosmetic issue, you know, again, don't feel as though just because it's cosmetic doesn't mean that it's not important. The way that we feel about ourselves, our self-esteem is very important. Our skin directly impacts that. Being covered with red spots, you know, can make you feel poorly about yourself, make you embarrassed during, you know, maybe intimate situations. And so don't sell yourself short of pursuing treatment for these things. While they're not covered by insurance, it is something that can be taken care of and, you know, helped. What you have to wrap your head around, however, is the fact that it may not be possible to completely erase all of them, particularly if you have a couple hundred of them. I mean, that's a pretty time-intensive thing to intervene on. But personally, I have, I don't know, 40, 50 of them on my body myself. They don't necessarily bother me cosmetically. They're kind of dispersed and very, very small. I anticipate I will get many more of them as I become wiser. They have increased already in number with my growing wisdom. Some of them I have treated and they've gone away, and I've gotten more of them, and that's okay with me. They're also very common in my family. People always want to show them to me and ask me what they are. So you are not alone out there. Ooh. Did you guys hear that? That is Vlogtober Day 5 brewing out there. The thunder and lightning. Ooh, spooky. But anyways, guys, I'm going to conclude this video here. I hope it was helpful to you all out there wondering about these little red pesky spots. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys in my next